I'm Dominic Fiacco, and I am introducing the topic of BMI and its favorable alternatives. First, we must ask ourselves, what is BMI, and why is it needed? The Body Mass Index, or BMI, is the most widespread tool for measuring body fat. The BMI formulates height and weight into a classification to determine if you are normal weight, underweight, overweight, or obese. This is important because of the dangerous health risks of obesity, such as increased rates of diabetes, heart disease, stroke, and even cancer. Why is BMI inaccurate? Well, despite its common use, BMI is quite inaccurate, often misclassifying individuals because of their age, sex, or ethnicity. The problems do not stop there, as BMI does not take into account the density of muscles, causing people with a more muscular build, such as bodybuilders and athletes, to be deemed as obese or overweight. For instance, our beloved Dwayne Johnson, also known as The Rock. Standing at 6 foot 5 inches tall and weighing 260 pounds, is a hulking man with an impressive physique. The BMI, however, classifies him as obese. Not overweight, but obese. Action movie star Vin Diesel, standing 6 foot 1 inch tall and weighing 251 pounds, is also classified by the BMI as obese. Well, we must ask ourselves, what are the alternatives to BMI? There are several alternatives to BMI in use today, some more commonly used than others. Alternatives such as the CUN-BAE, the RFM, the BAI, hydrostatic weighing, and TST. The first alternative is the CUN-BAE, or the Clínica Universidad de Navarra Body Adiposity Estimator. It uses the well-known BMI formula and adds the factors of age and sex to ensure a more accurate result. The CUN-BAE has shown promising results in calculating the risk of type 2 diabetes in patients with a high CUN-BAE as compared to a high BMI. Despite being created to fix the weaknesses in BMI, it still suffers from the same weaknesses of age and sex. Another alternative would be the RFM, or the Relative Fat Mass Scale. It boasts a different formula, using the height and hip circumference to get the measure of body fat. This scale has been thoroughly tested in California to focus on getting an accurate measure of different ethnicities, such as Mexican Americans, European Americans, and African Americans. While not showing much weaknesses, its alternative measure of BAI does. Now, the BAI, or Body Adiposity Index, uses the same height and hip circumference that RFM uses, but its results quite differ. BAI claims that its index does not require any adjustments for factors such as sex or ethnicity, allowing a faster and easier way to measure for body fat. But despite these claims, BAI suffers from its lack of accuracy, overestimating the body fat in males and underestimating the body fat in females. Now, another alternative would be hydrostatic weighing. It is a very accurate unit of measure and is mostly used in physical therapy and private care. But despite its accuracy, it is deemed complicated to implement in widespread use. Hydrostatic weighing requires a person to be completely submerged into water. Now, this is to calculate the underwater weight of the person. As fat is less dense than muscle, it allows a solid grasp of the differences between weight by fat and weight by muscle. But due to its complicated measuring process, it is primarily used to measure adults, and often is seen as unsafe to measure all populations. Populations such as the elderly and the ill, as it would require too much effort from the lesser abled. Now, the last alternative I will be talking about today is the TST, or the total skin fold thickness. Now, the TST is used to determine a body fat by pinching the skin, pulling, and getting a measure with calipers. While it is an accurate unit of measure, TST is more dedicated to finding total body fat, rather than focusing on finding the obesity of the patient. So this does not allow early findings in the health risks associated with obesity. But while used in a healthcare setting, TST remains to be intrusive, often making someone uncomfortable, as a practitioner will grasp at their skin, pull it around, and it just makes it an embarrassing experience for most people. Now, BMI is a very important healthcare, and it is a valuable tool for finding risks of obesity, but the accuracy is subpar. There are various other methods to consider when wanting to calculate body fat percentage. Now, these methods could be more accurate and do not require a large change in practice. It is important to know your body fat to make healthier choices, but be aware of your options and do not settle for BMI.